He is one of Kenya's cardiologists. He has been in the medical profession for over 50 years and now recounts the ups and downs of this journey. My name is Dr. Mercy Korir, and on this episode of Doctor's Diary, Sada Hassan sits down with Dr. Dan Gikonyo, who at his age and being a grandfather is not yet done. He has dreams and plans that may further shape the medical industry.
My name is Dr. Dan Gikonyo. I am a cardiologist, that's a heart specialist, based at the Karen Hospital in Nairobi, Kenya.
Medicine is a lucrative job and fit for some people. Dr. Gikonyo says one's disposition plays out when determining which career to pursue.
Becoming a doctor is not an easy job, but it's easy if that is what you desire to be and are happy to be. Because to be a doctor, you must be a person who likes to help people. If that's not inborn in you, if you get tired of helping people, then you cannot become a good doctor. So there's a personality that makes a doctor, that makes a nurse. There's a personality that makes a policeman, personality that makes a judge. There's all these personalities you're born with. And if you go in the wrong profession with your personality, it may not match. I've seen many of my friends who won't become doctors. They go to medical school, but when they finish school, they can't practice. They find it very difficult to practice as a doctor because they really were never that material for geared to help people, because doctors are made to help people. It's not the amount of money you make, it's not the prestige, it's the desire and the satisfaction you have when you help somebody who is in need.
He hails from central Kenya, and as he puts it, his was a normal childhood.
Born in 1950 in central Kenya, in a small village called Ihithe. That's 70 odd years away. Just like anybody else in that time, we grew up as ordinary villagers. I don't pride myself in that because everybody in my age group grew up like that. There's nothing special to say that I went to school without shoes. Who went with shoes those days anyway? Or to say I came from a poor family, who was rich those days? So we all are the same. And whether you are from a rich family or a poor family, whatever, the goal and the expectations is the same.
Milking cows and picking pyrethrum was his way of life, and he pretty much enjoyed it. However, he was born during a dark period in the region's and Kenya's history.
The only difference is that, as you know, those of us who were born in the 50s had to grow up in central Kenya at the time of the Mau Mau. And that was not easy because, of course, unknown to many people, Mau Mau was a war against the British, where the British retaliated by putting the villagers into small prisons, as it were, in the villages. The villages became prisons. They were surrounded by barbed wire. You lived there. You are controlled. Your movement was controlled. So the whole of central Kenya, from 52 to about 58, was just one big prison. The others went to the most worst prison, the real prisons, like Manyani or Mageta or other places. The hardcore Mau Mau were taken there. But every Kikuyu and Meru in that region and Embu were all prisoners because we were made to stay in a village. It's surrounded by barbed wire. There's a guard there. You cannot get out of that village unless you're allowed. You have to go to school. The kids will be guarded to go to school. They are brought back. By 6 p.m. in the evening, you must all be inside.
He was lucky to attend school at an early age, something unusual during those times.
Because my sister was a teacher. My mother allowed her to take me to school because I was the last born. Instead of being left at home alone, she took me to school. Primary school was easy, but I had this desire to become a doctor, even by the time I was 10, for two reasons. One, in the 50s, there was one very famous doctor in central Kenya called Dr. Julius Gikonyo Keano. I always thought he was a medical doctor, only to learn later he wasn't a medical doctor, he was a PhD economist. But to me, that name of Dr. Julius Gikonyo Keano, and being my name was Gikonyo, I started calling myself Dr. Gikonyo because people liked that guy very much. He was very popular. In the village, people talked about Dr. Gikonyo Keano. He was popular, he was a good politician. Women sang songs about him. And I felt I'd like to be like that guy.
But that was not the only motivation that led him to the medical field.
My mother had asthma. She was always very sick. I had a brother who was epileptic. You know, the idea of getting into contact with disease as a young child was very real to me. And what puzzled me was that the doctors who came to see my mother with her asthma, or the one who saw my brother with epilepsy, were not doing much. I couldn't see why they were not succeeding in getting them better. So I just designed myself, one day, I'd like to be a doctor.
After performing well in primary school, he was admitted to Kagumo High School to pursue his A-levels. He, however, had a different desire that was dashed by a language barrier. It was basically a clash of English.
I always wanted to go to Alliance. And the Alliance headmaster used to come around and interview boys. I still remember the interview I went. And this was the first white man I came into face-to-face contact with. And here he was in front of me, interviewing me to see whether I can go to Alliance High School. I had been taught English by my teachers, good Kikuyus, who spoke very good Kikuyu English. And here's a white man speaking English. I'm supposed to respond to him. And let me tell you, what I remember saying most of the time was, "Sir, I beg your pardon." I never succeeded in the interview. So be it. It was a language thing. Anyway, so I ended up being Kagumo. And because I always wanted to go to Alliance, I kept telling myself, I must do very well. And I must tell you, by the time we went to Form 4, the O-levels, I must have done much better than many of my friends who went to Alliance High School. I may have been one of the best boys those days in the whole district in the O-levels. In those days, the O-levels were graded with grades 1 to 6. If you got a 1, you had done very well. And then you had 6 subjects to choose from. So you've got 1 in every subject for 6 subjects. Your aggregate was 6 points, which was the best you could ever get. And that was what I got. So A-level again, the same Kagumo High School, where even today, by the way, I must tell you, I'm still the patron of the old boys of Kagumo High School. I must tell you that even in my little village of Kagumo, over here, in my little village, I'm still the patron of the alumni of that primary school. So I've kept contact with those schools. So after A-levels in Kagumo Medical School, 1970. That's close to 52 years ago.
He says that joining university in the 70s made him and his peers the cream of the society, and that life was easier then compared to now. It is at University of Nairobi where he met the love of his life and partner, Dr. Betty Gikonyo.
Dr. Betty Gikonyo and I were medical students together. We were the same class. We went to the same lectures, had the same tutors, had the same interests. You know, medical students don't have time to go around in town. So most medical people who are either married, the nurses they work with, or their colleague doctors. I won't say what else after that. Because of that, most of them may go to a pub and woe unto you. Well, we had common interests. We were both from Nyeri. Betty is from Madeira, I'm from Teto. So we had common interests. And this is what has held us together this year because of common interest.
However, being a general doctor was not enough. He got an opportunity to specialize in a field many regard as tough.
I had the privilege of going to the United States, the state of Minnesota, the city of Minneapolis, the Twin Cities. I went there in 1982, and that's where I did my training as a cardiologist. We still went together with my wife, Dr. Betty Gikonyo, and as I was pursuing by that time I finished my postgraduate training in adult medicine. So I was already a physician. I was an internist. So now I was just going for cardiology. And I would like to mention something about that because, again, opportunities don't just come from nowhere. When I was a physician at Kenyatta National Hospital, I must tell you, I worked very hard. I worked long hours. When I went to the clinic to see the patients, I would not leave that clinic until all the patients were seen. Even today, when I go to the hospital, in Karen Hospital, and I'm seeing patients in Karen Hospital in the clinic, I wouldn't leave until they are all seen. Even if it takes longer, if it goes 6 o'clock, 7 o'clock, I do not leave the clinic until the patients who have come have all been seen. I find it difficult to tell someone to go home and come back tomorrow. He came because he was unwell. Why are you telling him to go and come back tomorrow when you can finish for him? And all you're looking for is your own comfort of going home early or going to play golf or going to have a drink here. Why can't you spare that time and help that person? So one day, I must tell you the story, at Kenyatta National Hospital, we were running a heart clinic. And there were many patients, but I kept on seeing them because I didn't want them to go home before they were seen. And it's one of those late afternoons when you have forgone your lunch, that a Lutheran minister came to the clinic looking for the professor because he had something he wanted to do. He had a child he wanted helped. I was the only one in the clinic. And I helped the man. And the Lutheran pastor was very happy. And he came back a few weeks later and told me, you know, I know some people in America who want to train somebody to become a heart surgeon. And I thought about you. I told him, listen, I'm not a surgeon, I'm a physician. But if you want to be a surgeon, I know a few of my friends who want to become surgeons. And in fact, I introduced him to one of my surgical colleagues, Dr. John Karaoke, who is now a very famous heart surgeon in Nairobi Hospital. But John had already found a place to go on his own in the US. So I told my friend, listen, the man I know can't take it. He told me, you know, I'm going to go to the same sponsor that asked them if they cannot take a surgeon, can they take a physician? I said, you try. He came back and told me, you know, they have agreed. They'll take you.
After coming back from the United States, he worked at a local hospital, but felt that his demands were not being met. He could not do charity the way he wanted. Together with Dr. Betty Gikonyo, they founded Karen Hospital in 2005. They ran the Heart to Heart Foundation from the hospital.
I've always felt that medicine can be run efficiently and professionally, more than I have seen in other places. And coming to Karen Hospital, we wanted to prove a point that medicine can be run efficiently, even as a private hospital. So we had common interests. And this is what has held us together this year, because of common interest. Even when we came to think about the hospital, Karen Hospital, we had the same interests. We want to help children with heart diseases. We formed the Heart to Heart Foundation together. And the common interests continue. We are lucky because same common interests are with our children. Dr. Anthony Gikonyo, who is now a fully trained interventional cardiologist, has the same interest. Our daughter, Juliet Gikonyo Nyaga, did public health in New Orleans, and she's a specialist in public health. She's now a chief executive in the hospital here. So,
how easy is it to work with his spouse in the same field?
And I've come to the true conclusion that yes, it is easy. I can tell you, and I tell the young people all the same, as you get married, choose a profession that matches your profession. Because you have very different professions, different interests, different time frames, you may end up not being together because one person has this interest or your profession takes you this way, you cannot merge. But if you are both common interests, same doctor, you are both doctors, same interests, same focus. When you talk about planning, you're planning about the same thing together. It has been much easier. I'm not quite sure that if my wife was not a physician, was not a doctor, I'm not sure that we'll be together today. I tell you why. The hours that we put into hospitals and patients, if your wife is not an understanding person, she cannot stick around with you.
The demands of his profession have costed him important moments of his family, more so his children. But he says they are some of the consequences those in certain careers pay.
I remember the 10th birthday of my son Anthony in the United States. And we had gone out to a nice place, a nice restaurant to have this birthday little bash with him and my wife and the other two little kids, and the cake was being brought. Those days there were no mobile phones. We used to carry something called pagers. They used to go beep beep beep. Then look at the mat, and then there's a message here, come to hospital or something. So here we are. We're about to cut the cake, and my pager goes beep beep beep. I have to leave, and I left the birthday party for my son. Back in my mind, I kept thinking that he must have be very upset. When he went to medical school, I said, how can he want to become a doctor after he saw what happened to his birthday with his doctor father, and he still went to become a doctor? But well, he still became a doctor.
Having spent over 50 years in this space, he has taken up some key lessons.
Medicine can be done efficiently and inexpensively. There are things that make medical care expensive. And one of them is, of course, wastage of resources. Because, let me give you an example. If you have a CT scanner in any hospital, and you have many CT scanners and other equipment in hospitals, public hospitals, that scanner can work 24 hours a day. It can work, it can be utilized continuously. So why do you have to have hours to say that these are the working hours of this hospital, and this is what you do, you don't do this on a weekend? The equipment is there. It's expensive equipment. There are people waiting for procedures. Why aren't those equipments running continuously, day and night? If you own a taxi, for example, ferrying people, you work as long as there are passengers. And if you go to sleep and somebody comes and says, listen, oh, take me to town, and it's late, you still wake up and take them because it's your business. So medical equipment is not fully utilized. You have, as I say, and I can give an example of Kenyatta National Hospital, where government, which is us, you and I, our government, have put equipment there. Why is that equipment not being used continuously for 24 hours? Why is it not being used on a Saturday afternoon, on a Friday night, when it's needed?
What next for Dr. Gikonyo?
Well, what next? I'm 70. And I said, at 70, I advise people don't make too many big dreams, because, as I say, at 70, sometimes I wonder whether I'm going to buy green bananas, because I know whether they'll ripen or whether it will be there when they're ripening. I just buy ripe ones and eat. But 70, having looked at my other people older than me, I've seen very active people at 90. They're still in the golf course. So I tell myself, well, let's see, got another 20 years to go. By the grace of God, if I have good health, and good health is partly a gift of God, but it's also partly your own responsibility. You can damage your own good health. And it's easy to damage your own good health. Start smoking cigarettes, you knock out your kidneys, you knock out your lungs. Don't control your blood pressure, you knock out your kidneys, you get a stroke. Don't control your blood sugar, you get complications. So although good health is a gift of God, good health is also our responsibility.
When he is not working at the hospital, he enjoys observing nature through taking walks and listening to good music.
I see my patients, I give them my time. When I time to rest, I go rest. I do my exercise in the morning. I have a treadmill in the house, which I use once in a while. On Sundays, I go for walks, long distance. As you know, last month but one, me and Rafael Tuju, we walked from here to Kijabi, 57 kilometers. That type of physical fitness is part of keeping yourself healthy. I enjoy walks. I don't play golf. I tell people who play golf that I've got my own handicap called time. But if you ask me what I enjoy doing most, the thing I love most was to go to theater and watch plays. That I've enjoyed. And I like going to watch plays. Now, of course, the COVID, you don't do as much. But it's one thing I really enjoy.
Speaking of people in power, tell me about the pictures on the walls.
This is 2003, taken upstairs in the White House. We had gone for a state visit. By then, the third president of the Republic of Kenya, Honorable Mwai Kibaki. That, I think, was his first international visit that happened to the US. And this is George Bush, you can see him there, and other cabinet ministers of the Kenya government. You can see Mr. Muraria facing that way, Gerald Dwega facing us. And
why was this visit important?
No, this visit was very important because, one, it was soon after Honorable Kibaki won the election as the president. And by that time, you remember, even the American president was very happy of Mwai Kibaki introducing the free education. He is one person who believed that education is the best tool that you can give to any nation.
Right.
Oh, these are my grandchildren. This one is called Gikonyo. He's now just turning 9. He wants to be a doctor, as you can see. Yeah. And he's also the one on that picture there. He's the one in the blue. And this is his brother. It's called Mwangi. And what I like about this picture is not, although it looks like a post picture, not posing. In fact, it was just next door. And we were just playing with the children. The mother had brought them. We were just playing in the room there. And she just took a camera and took a picture. So this was taken not by even a professional person. These two were taken by their mothers. And that's why I value them very much, because it's incidental, accidental art. You just take it. It comes out very nice. As I say, grandchildren are the best gifts for anybody, because you have all the pleasures and privileges without any responsibility.
His message to the youths is that
define and decide very early what is your goal. What do you want to become in life? Once you have decided, put your time and your heart and your mind into it. And when you put your mind and time into it, invest in hours. There's a book called Outliers that defines what it takes to be successful, because people only see successful at the end. Look at the band of the Beatles, and you assume that they became famous overnight. By the time the Beatles became famous playing in London, they had played in little clubs all over Europe, practicing. When you look at people who have, like the man of Windows, and people who have done made great inventions, by the time they come to do that they know best, they have spent a lot of time doing basics. If you ask someone like Kipchoge, by the time he breaks the marathon record, he has practiced and put hours into it. So I tell the youth, once you decide what you want to be, and you're on the right road, then invest in time. Do it many, many times until you get very good at it. But be honest all the time, and don't take any shortcuts, because there's nothing to be gained that way. You may get there very quickly, but you'll lose it.
It is said that life is for the living, and not just living, but living it meaningfully. For Dr. Dan Gikonyo, amassing over 50 years experience in this practice, he has definitely lived it meaningfully. And he says more is yet to come if God gives him the grace. Saad Hassan for Doctor's Diary, KTN News.